In using emotionally focused family therapy, we're directed to acknowledge the bonds and roles that exist between parent and child, especially when those parties are biologically connected. Very often, we're also working with step parents and stepchildren, which presents different challenges and important opportunities in developing connection. I'm Rebecca Martinez Fitzgerald, a licensed clinical social worker associate practicing with couples and individuals in Durham, North Carolina. I'm talking today with Jenna Teves. Jenna, can you tell us about yourself?
I'm Jenna Teves, and I'm a licensed clinical psychologist based in Charleston, South Carolina. I work at the VA Medical Center here in Charleston, as well as in private practice. And I've been using the EFT model for about 8 years, and I'm a certified EFT therapist and supervisor. I focused most of my work on couples and individuals, but more recently have started branching out into doing emotionally focused family therapy, in particular with step families.
Awesome. Yeah, that's where we met. We met in an EFT training. So that's cool. So there are really diverse experiences across step families. What factors influence your case conceptualizations?
Yeah, so as with any family, I would definitely want to look at the negative cycle, right? And the attachment experiences and strategies that shape how each family member moves in the cycle. But with step families in particular, there are some key attachment experiences that they have that biological or first families do not. And so all step families have been preceded by the disruption and loss of the original family through either divorce or death, and whatever chain of events led up to the divorce or death, right? So divorce might be the end result of, a marriage that's been really disappointing, conflictual, maybe distant, right? Or, the death of a partner and parent may have been preceded by, long and difficult illness that's left its mark, or a horrible accident, right? And so when step families form, right, there are understandable fears on the part of everybody involved, right? The new parent, or the parent rather, right? And the kids as well, right? Fears of facing kind of more loss and more pain in this new family that we're forming, right? And for kids, their parents' accessibility might have already been compromised by the difficult events in the first family, right? I mean, divorce, death of the spouse, that kind of thing. It's hard on everybody. And so kids might fear, well, am I going to lose parental accessibility like even more, right, going forward, right, with these new people in my life? There's also the hope, though, right? So parents enter this new relationship and this sort of new step family by choice and with hope that they can make a better life, right? Kids may not have so much of a choice. And so they may be, but aren't always, a little less hopeful at the start. Now, there's a range in that, of course, as well. But the point is that as we know in EFT, right, fears prime protective action tendencies, right, which can block or complicate the development of close relationships. And so attachment experiences in the first family are important to know about and assess when we're looking at treating the step family as well.
Okay, thank you.
And I think, just one more thing too, is there, of course, are kind of factors around the kind of functioning of the step family currently, right? And there are just a few factors there. So one is how much time they've had together to mesh,
Right.
a newer step family versus like one that's been more established, right? When you're starting out, it can be kind of a culture clash. You're bringing two different cultures together. But roles tend to get a little more firmed up as people go through the years together, right? Another thing would be just how old and what developmental stage the kids are when the family is formed. So if we're talking about little kids, right, that's going to look different in terms of the bonds than if we're talking about adult children of an older couple getting together, right? Custody arrangements too can influence how much people are able to bond and what complications they are.
And the attitudes towards those arrangements, I'm sure.
Yes.
Yeah.
Absolutely.
Okay.
Yeah.
Cool.
Yeah. And then, just a couple other things, which is that the role that the other parent plays or the ex-spouse, right? There can be anything from kind of a lot of enmeshment, right? That with the ex to complete separation, right? And so there's, it's advised to have good open communication about kid things, but some boundaries about other things, but that can be more challenging in practice. And then obviously the step parent, right? So a step parent can be influenced by things like gender, right? So males coming into the role because of sort of the male gender roles pressures, right? May kind of come in with a stronger need for establishing authority, and that can be more of a challenge as a step parent, right? Because you have to sort of earn the ability to discipline through building a relationship.
Power dynamics influencing the way they show up.
Exactly.
Yeah, totally. Cool. Well, I appreciate you talking about those factors that you're considering when you're planning your approach and doing work with these families. What are some of the common themes that emerge during treatment?
Yeah. So I would say that that these are kind of variations on the themes that would come up for any other family often. So things like parenting struggles. So how how lenient versus sort of strict to be with discipline, concerns about kids and how they're behaving, or just general kind of difficulties with getting along or communicating. But the thing is that step families do kind of have like an added layer that can accentuate some of the standard struggles. So, sort of like I alluded to, right? If, dads and moms might disagree in a first family, with dads, being kind of more interested in laying down the law, getting that respect, and moms being more interested in doing this sort of gentleness. And yes, that's a gender stereotype, but it does play out in many couples, right? But the conflict can be heightened and sort of polarized even more when we're talking stepdad and mom, right? And another thing is, so, some families kind of come into therapy because, kids aren't listening, they're rejecting or what we're saying, that kind of thing, right? And while no parent wants to feel kind of rejected or dismissed by their kid, right? And all parents do in some way at some point, right? Step parents who are sort of having this longing to connect with their new family, right, might feel especially discouraged when they face rejection from one of their stepkids, right? And when those bonds don't form as quickly.
Yeah, that makes a lot of sense.
Yeah.
So I'm hearing you say like a lot of the considerations are similar, and yet there's this added layer that affects each of these dynamics. So considering that, step parents may deal with a lot of the same things that, first parents might in their relationships, there's also difference to consider there as well. So in your experience, what is it that step parents need that's separate from the first parents?
Yeah. I mean, and so again, I guess it's similar things, but maybe, well, I'll tell you what I do think they need. Okay. So one thing that they need is time, right? So I think about the step family researcher and therapist, Patricia Papernow, who, sees the term blended families and is like, that's just not it, right? It's really not a blender. It's more of a slow cooker, right? We need sort of time in the family, both with the family together, but also one-on-one time between step parents and stepchildren to kind of nurture those relationships, as well as, parent and step parent needing time to kind of work on and reflect on, think about, how to kind of build and coordinate the step family.
Mm-hmm.
So in addition to time, another thing would be support, right? And that's in different areas. So step parents need support from their partners as they establish the step relationships. And, it takes a lot of patience and openness, right, to navigate some of the blockages and protective strategies of the family that they've entered, right? Mm-hmm. As well as, of course, their own blockages and protective strategies. And it's hard for any of us to maintain patience and open-heartedness, right, without some support. And
so you're talking about like the partner, really collaborating to support with the parent,
right?
And, becoming part of the family system.
That's right. That's exactly it. Yeah. And then, since we're talking about what we can do as EFFT therapists too, right? They also need support from the EFFT therapist. Mm-hmm. And obviously all members of the family do, right? Sure. But I think in particular, EFFT therapists can support step parents by listening for the caring that they have for their stepchildren, listening for what can block it at times, right? And honoring both the caring and the blocks. And I think this is actually really important because in every step family that I have seen, I am able to find a step parent's caring for their stepchild.
Okay, yeah.
Yeah, which actually, in a sense, shouldn't surprise us. Right. Because even though there's not a biological bond, we do know that caring is an innate adult capacity and drive. Mm-hmm. But step parent caring might be blocked by the step parent's own kind of attachment wounds and fears and strategies that predate the step family formation, but also by kind of step parent reactivity, which might be triggered in familial kind of contexts, in the society, or even in a therapeutic context where that caring is kind of dismissed or ignored.
Yeah. There's expectations, there's stereotypes, and then just the reality of their patterns that are all going to influence what helps them, follow through on that care or to pursue that care.
Yes, exactly. And I guess the other critical piece in terms of what step parents need is that education can be helpful, right? And I specifically mean that sort of normalizing that it takes time, like maybe a decade, right, to really mesh in step family relationships. And that is maybe longer than people might expect, right?
Yeah.
And also that I alluded earlier to kind of rejection, right? But that step parents may face rejection and mistrust from step kids, which is basically a survival strategy, right? That kids used when they've been made to feel that in accepting the step parent, they're rejecting their other parent, right? Their other bio parent, right? And the point here is that this kind of mistrust and rejection is not only not personal, but it's not permanent when step parents can roll with it compassionately and continue to care through, through the tough times for the kid.
Yeah. Okay. So how can we empower a step parent to seek secure attachment with a stepchild while respecting the roles and the differences of a first or biological parent?
Mm-hmm. Yeah, absolutely. No, that's really important because, biological parents do have a different sort of role / like differences in attachment in the sense of just having this kind of intrinsic, almost sort of really deep rooted and automatic attachment, let's say.
Can you repeat that last part? Sorry, it clipped a little.
Oh, that's okay. Yeah. I mean, so so first parents or bio parents have a deep-rooted and automatic attachment, right? Where step parents don't, by almost definition, have such deep roots. They haven't been with the kid for as long, right? And they're coming in sort of from the outside, right? So those roots need time to grow. And it's more along the lines of an earned rather than automatic attachment. Yeah. But it also, you know, we don't need to assume that it's shallow, but we do want to assume that it's not as deep rooted, and that, you know, it can be nurtured.
It can be nurtured. There's potential there.
Yeah. And, you know, here's the thing is I think it actually is important in many of these families to really kind of work on the empowering of the step parent, because the sort of bio or first parent, you know, may feel like they're sort of stuck in the middle at times, right? Between loyalties to their kids, very important, and loyalties to their new partner, right? And if we think about kind of the fears and hopes, you know, that that people have going into the step family, you know, parents may have a lot of protectiveness towards, you know, kids who've already been through loss, possibly trauma, and may worry in a sense about, does the step parent really love my kids and look out for them the way I do, right? And the parental fear may come out as pushing the step parent away or criticizing them, right? And it puts a step parent in a bind, you know, because then they might feel pretty disempowered, rejected, stuck in the outsider role. And then they're like left with the position of either doubling down on behavior that might not be that great, right? And that is certainly triggering, or kind of building up some self-protective walls and distancing, right? In either approach, right, is likely to just increase bio parents' fear and mistrust. And then we've got this parent-step parent cycle, right? And so nobody wins with that. So my thought here is, in my observation from cases that I've worked with, right, families that I've worked with, is that if we can access and enact the step parent's heart, their caring intent, right, the parent usually feels a level of relief and support, right? It's like they get the message that their partner is their teammates in this enterprise of nurturing the kids in their shared family. And that's a really wonderful thing.
Yeah, that's beautiful.
Yeah.
Well, is there anything else you'd like to share?
Yeah, I think the final thing is, you know, step families are often, at least in our culture and maybe even in our field sometimes, right, seen through kind of a deficit lens, right? And I think this, while it may get kind of half the picture, right? It sort of can obscure the full picture of step family potential, actually. So while it's true that step families are born out of the ashes of loss and trauma, right? And it's true that they have additional layers of complexity. It's also true that many step families have significant strengths and resources and resiliency. And so there's this saying, right, that it takes a village to raise a child.
Yeah.
And my sense is, like, when we can improve the attachment bonds between step family members, that we can bring the diversity and the resources of that village into the safety of the home and enrich the family and everybody in it.
I love that. I think that's a beautiful way to think about that. Jenna, thank you so much for your time today. I really appreciate your work, and I appreciate you being here.
Thank you. I really appreciate this chance to talk to you about this. Thank you.